from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about changes in healthcare delivery and strategic growth of healthcare systems. Our guest today is Sarasota Memorial Healthcare System President and CEO, David Verinder. David, thank you so much for joining us.
Thanks for having me, Allison. It's great to be back on the podcast.
So Sarasota Memorial is approaching its 100th anniversary coming up next year in 2025. That's a big deal. How has the health system grown with the community over the years? Obviously, we recognize healthcare itself has changed in that time, but how has the health system changed?
Well, it is pretty amazing that this organization is now going to be 100 years old. And the growth of this community is astronomical over that period of time, but even particularly over the last, say, 15 years. It's just been an incredible runway of growth. I look at it and I see that the healthcare system is very much part of that. We're part of the DNA of the community. We grow with their needs. We continue as the community needs evolve. We evolve, and we try to continue to be better and make sure that we're providing everything that we possibly can that the community has a need for.
I recognize that you've been with the healthcare system a long time, but not the 100 years. But we started as a healthcare system looking back in 1925 with 32 beds. When you look at now where we are, 2 hospital campuses, the wide array of a freestanding ER, we're looking at continued expansion, of course. We have all the wide array of physician offices and outpatient services. When you think of how far we've come as a healthcare system, what does that mean to you and to the community that is benefiting from these services?
Well, we continue, if you look back in time, I think where Sarasota Memorial, the Sarasota campus is located, was looked at as part of the fringe of the community. It wasn't even part of the central part of the community. And now the community is so large that we're not only in the middle of it, we're actually probably on the fringe on the other side of it now. And we continue to put facilities out to make sure we take our services to our patients. We started putting urgent cares out probably 15 years ago. We started that freestanding ER in Northport. I'm thinking that's about 16, 17 years ago now when we started planning for it. It was the second freestanding ER in the state of Florida, and I don't know how many there are now, but I think it's in the hundreds. So, we continue to evolve as a system. We continue to bring services to our community, and we're here to serve.
Sarasota Memorial is a public healthcare system, and that public mission is very unique to our region. What are some of the benefits of having a public healthcare system in the community? And how is it different from other hospitals and healthcare systems?
So when you look at the region that we serve, and we don't just serve Sarasota County, we serve a lot more than that. And I would extend our service area, say south of the Skyway Bridge or south of Tampa Bay and north of Fort Myers. While our primary service is Sarasota County, we serve all those other communities as well. We're the only public hospital, we're the only not-for-profit hospital in that entire region. All other hospitals are owned by for-profit entities that some headquarter in Nashville, some headquarter up in Pennsylvania. Those are, fine hospitals. There's nothing wrong with that, but they have very limited scope, limited services of what they do. Okay, we do everything. We're a safety net hospital. We try to serve all needs, depending no matter what the payer source is or what the profitability of the service may or may not be.
Can you talk about what some of those mission services are?
Sure.
Give us a few examples.
Sure. We're a level 2 trauma center. So that means I have teams of people standing by in case somebody has an issue. We're a stroke center. So we have, if you get brought here to Sarasota Memorial with a stroke, there are dozens of people waiting for you to come in and take care of you. Time is brain, and your outcomes are just going to be better in a situation like that. We're the only place that delivers babies in Sarasota County. We have a NICU. We have partnerships with other organizations across the nation and across the state to make sure that we can deliver the best care to our patients at any given time. Those are just a few of the things that we do. But it would take your entire podcast to go through everything.
Being that it is not-for-profit and public, everything is invested back into the community, unlike maybe a private health system. So what are some of the recent critical investments Sarasota Memorial has made back into the community that you're most proud of? I know, like we said, the health system has grown so much. We could spend the entire time just talking about new locations and facilities, but what are some of the things you're most proud of?
So you make a very good distinction there. So everything that we do in this community, everything that the hospital has excess revenues over expenses, it gets put right back into the community. And that's new services, it's new buildings, it's new programs. That's differential for what the other hospitals in this community are doing. They pay a dividend to their shareholder. And I think that's something that shouldn't be missed. We have spent, probably $1.5 billion over the past 5 years doing nothing but building out new facilities, new services for the community. I want to mention a couple of them, okay? I think like one of my more proud moments, and I've had a lot, there's a lot to be proud of here because the people here are so amazing. The community is so amazing to be supportive of this organization, and I'm just proud of the entire organization. But I think one of mine was probably 10 years ago. We set out and we looked at what are we not doing for the community that we could do, and that's hard to look, okay? Because then you got to become a little bit self-critical. And so one of the areas that stood out was cancer services. And we did the hard look. We identified that over 50% of the people that were diagnosed with cancer in Sarasota County were choosing to leave leave the area for treatment. Now some were going to Tampa, some were going to Houston, some were going up to New York, all kinds of places. We do live in an area that's fairly affluent, and people have choices, and they can make those choices. And they were choosing not to stay with us for whatever reason. So we did a lot of work, a lot of self-evaluation, found out where those issues were, and then we put a strategic plan behind that to address each one of those. Mostly encircling the patient, making sure that when a patient came here, that they were treated as if they were the only person that needed treatment. I'm very proud. We've built new facilities. We've recruited new physicians. We've augmented the physicians, the great physicians that we had. We've put in new services that never existed in Sarasota County before. And I'm proud to say that today, 30% of the people that are diagnosed with cancer now leave the area, and we're retaining 70. A remarkable change in what has happened, and we don't think we're done. We're continuing to do this. We're building a new cancer tower right now with new services, and we're very much looking forward to things like that continuing. Another area I know you wanted me to ask is a new hospital in Venice. Our county and our service area continues to grow south of where the Sarasota campus hospital is, and so we are continuing to put a lot of resources into what we call South County, or south of our service area, whether that's Venice, Florida, Northport, Florida, and other areas that are in that region. We built a new hospital in Venice, 2.5 years ago. The day we opened, 5 days after we opened, we were completely full. And we've been completely full since we've been open. And all we've been trying to do since is bring more capacity to South County, and particularly that campus. By the end of this year, we will have doubled that campus by its third birthday, effectively. And it's going to be completely full at that third birthday. So guess what? Construction's never going to stop there. We're going to continue to grow. We're going to continue to identify the needs of our entire community and put resources behind it.
And one of the mission services as well that has expanded that I know we wanted to talk about just opened the Cornell Behavioral Health Pavilion. that's a mission service. Behavioral health services are not offered everywhere. And we not only expanded those services, we built a whole new building for that. So can you talk about Sarasota Memorial's investment into behavioral health?
Well, I think that's a great topic to go on and a great discussion point. Behavioral health is a national problem. I think that everyone will agree that it is underfunded nationally, and Florida's no exception for that, and Sarasota's no exception to that. When we took a hard look at where our behavioral health services were, they were very challenged in Sarasota. It's still challenged, but we had a hospital in Sarasota on our campus that we owned that was really there when you hit crisis mode. And to say it was worn and say that it was past its prime would probably be a very big understatement. We decided it was not acceptable for our mission. It was not acceptable for the community, and we needed to do better and think broader. So we built that new facility, the Cornell Behavioral Health facility, and not only didn't just build a building, we built programs in it. We looked at ourselves and said, well, what else can we do? So we stood back and we put in outpatient programs in it. We put in partial day programs. And then we still have the inpatient part of that program. But our thinking is if we can get people involved in the outpatient side and give services there, and the partial day, maybe you don't get to crisis. Maybe it doesn't advance that far. You mentioned, Cornell, we had a donor step up, and we've had this several times throughout our organization over the last several years, where donors have stepped up in a very big way. And not only with their heart, but they've put their name on our building. And that's something that means a lot to me, because that means you believe in what we're doing so much that you put your reputation, your name on our facility, and people like Brian Cornell or Sheila Jellison or the Kachowskis, we can't thank them enough for everything they have done around that.
Because you mentioned the Kachowskis, I just want to briefly talk about that as well. For a public healthcare system, there's a very robust research and education program at Sarasota Memorial, which is not necessarily common, and certainly to have such a big investment. Not too far from where we're sitting right now, they are building the new Kolchowski Research and Education Institute. What is that going to mean for this community as a public health system to have that here?
I'm glad you asked that question. I think that research and education facility is really going to set us apart from a whole lot of different organizations around the country that may look similar to us. First off, you mentioned we have a lot of research that goes on at Sarasota Memorial Healthcare System. We have a lot of education that goes on here. Now, we've been putting those research buildings and those education and classrooms, everything, all scattered throughout the main hospital. And doing that, it's a little bit disjointed, and people don't see it. And on top of that, we have a capacity problem. So we stepped out, we have built this new building that's going to house all of our education activities, all of our research activities, auditoriums, classrooms, state-of-the-art everything. And we're going to vacate a lot of the places that now we can turn into patient care. So it's not just building this beautiful, shiny building, it's also creating capacity in our organization to put patient care, to take care of patients. The other part of what it does is we're constantly recruiting physicians out of large programs, out of the very successful, world-famous specialists from all over the country. And they're choosing to come here. Now, when they come, they also like to teach. They also like to do some research. And we have those abilities for them to do that each and every day through this new, and now they can do it highlighted in this new facility.
Good point. How does the system determine what is strategic growth versus growth for the sake of growth? Can you talk a little bit about that process in determining where the organization goes next?
Wow, that's a hard question. Okay, so ultimately it starts with our board. Okay, our board of elected public officials, who by definition are put on our board by the community that they live in. We sit with the board, we sit with the medical staff, we listen to community outsiders, we listen to our own management teams, okay? All come to us with all the different priorities and thoughts on where the system should be going. We do an extensive amount of research through that process, and then we allocate our time and capital to be able to meet the greatest needs that exist. It's hard to predict where that always is going to be 5 years from now or 10 years from now. Healthcare is so dynamic and changes so quickly that we want to build as much flexibility into that process as we possibly can. Sometimes those things change as quickly as a couple months from now. Sometimes, the arc of something might change over 5 to 10 years. Cancer being one of the areas that has a tremendous amount of change all the time. Well, in those facilities, we are trying to build the most flexibility that we possibly can. And I'll tell you what, if at the end of the day we cure cancer in 5 years and those things become condominiums or something, all the better.
Well, as you mentioned, there's plenty of capacity for patient care in other areas as well. You mentioned the rapidly evolving landscape of healthcare. What do you think will be the biggest innovations in healthcare in the coming years? And how do you think SMH is going to utilize things like AI, which I know is a hot topic right now?
I've been fascinated with AI. When you stand back and look at what's going on in the country, we don't have enough doctors, we don't have enough nurses, we don't have enough staff to take care of everyone in the country that needs health care. Florida's not immune to that, and Sarasota's not immune to that. So we at healthcare systems need to look at innovative ways to make sure that we meet those needs and exceed the abilities of our current staff, augment them, make them more efficient. One of the areas that has really set us apart over the last several years is our usage of AI in our logistics system. We are able to while an OR, somebody's in the OR, a surgery is going on, and notes are being taken in the OR, our AI system is able to predict when that surgery will be over and ultimately when that patient needs to be in a room. That makes a tremendous difference throughout our system of how we do bed placement. And I don't think it's exaggerated to say that I believe we have increased our capacity levels by 15 to 20% simply by the use of that AI team that uses it. And I don't want to focus just on the software. There's a whole team of people that do nothing but this every day, but that's a tool that they use.
So it hasn't replaced people, it's just helping augment their positions.
It makes them much more efficient. It makes our overall organization a much more responsive organization.
So I want to focus on that human touch. There's been an ongoing national shortage of healthcare workers and providers that you mentioned. How does SMH work to hire enough staff and have enough providers to keep up with the needs of the rapidly growing healthcare system while looking at still expanding? You mentioned Northport and our outpatient centers. How do we keep up with that demand knowing there's this national shortage?
Well, we're very blessed that we live in a community that people like to live in. So we'll start there. We are now over 10,000 employees. We have over 2,500 physicians and caregivers that are on our medical staff. We are constantly recruiting. We are constantly going through the process of rethinking how do we bring people in, and there's a whole lot of different methods. Now, I got to tell you, some of our methods may not be popular in other parts of the country. For example, in a snowstorm in Chicago, maybe we have billboards of palm trees, so we attract people like that. Getting around a little bit, but. Other parts that we do, we're a magnet nursing program. So we have been a magnet nursing program 5 times. So I believe that makes us over 20 years magnet status. We know nurses seek out hospitals that are magnet status, and reputation goes a long way. We treat our employees. We think we treat our employees very well. We have evidence of that by our Gallup surveys, our various awards that we get for being a top employer, not only in the region but in the nation.
And because we spoke about it before, research and education, you mentioned how research brings in other physicians and providers, but that education piece, Sarasota Memorial is also training the next generation. So can you talk a little bit about that?
You know, we have a robust amount of education that goes on here each and every day. I mean, we have 5 different nursing schools who send their nurse students here to learn to train and round on our, throughout our organization. We have 40 medical students every year here that are they're 3rd and 4th year medical students that are associated with Florida State University Medical School. They're here learning, training, and becoming a physician right now. On top of that, we have 70 graduate medical residents that are working each and every day here, honing their craft in internal medicine, ER medicine, and fellowships on top of that in a number of different specialties. I am very happy to report that 70% of these physicians that finish their residency program stay in the state of Florida, and 50% are staying in the Sarasota region. And to us, that exceeded all of our goals. And so we're looking forward to continue to expand that. We're bringing on new fellowship programs right now to help augment some of our specialists, our surgical specialists, and some of the ER specialists. And we're looking forward to having a much larger program in the future.
So I know we've talked about a lot of different things that we've done or are doing. And I also know that you mentioned that the strategic plan can change. But where do you see SMH going from here? And what will it mean for the patients of our community? Because it's very easy to listen to things and think, okay, they're growing that or they're building that. What does that mean for me?
I think that overall strategy is going to be continue to reinvest in our community. Community being defined as a very broad area. Some of that will be outpatient. Some of that will be physician offices. Some of that will be building new programs within the facilities, that bringing in specialists that don't exist in the region, or sometimes even the state of Florida. It'll be also building new hospitals. We have 2 new campuses we're evaluating right now. One of them will have a shovel in the ground in a year, I predict. And that'll be in the Northport region of Sarasota County. We're going to continue to look at where the growth is in our community, what the needs of that particular part of our community is, and then we'll answer that each and every time.
I know we've touched on a lot of different topics here today. Is there anything else you want to add, something you want to highlight as president and CEO?
I've been in this community for almost 20 years now, at SMH for almost 20 years now, and everyone on our management team, everyone on our board of directors, our medical staff fights hard for us to maintain our independence. And I don't see a time where that is not the case. I think that we have excelled by being independent, and I just want to make sure that everyone knows that is our goal, and that is our, we will always fight for our community and do that. I think when you look at where we're going into the future, we're going to continue to look in all areas. We're going to continue to look, how do we take this cancer center that we've been building for 10 years now, and what's the next level for it? How do we evolve that to take care of even more patients? We have patients coming in from all over the country into our cancer center today. That come in here because of the reputation of the physicians, the reputation of Sarasota Memorial, the reputation of our nurses. And they choose to come here and bypass a lot of very good places around the country. How do we grow that? How do we make that reach even more? How do we build on the foundations of the people that have put us here? How do we continue to look at various services and expand on that? I'm also extremely grateful and humbled to be able to work here. The staff, between the housekeepers that come in every day, the food service folks, our public safety department, our lab techs, our rad techs, our incredible nurses, and of course our medical staff that come in each and every day and do nothing but come in to serve our community, makes me extremely proud to be able to stand here and represent them on a daily basis, and it's something that I don't take lightly. It's something that I think we all owe them a debt of gratitude as a community, and I just want to say thank you.
David, thank you so much. Again, I know we touched on a lot of different topics today, and we could probably keep going for another hour at least, but I want to thank you for taking this time out. As always, we encourage everyone in our community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.